one of the things, kind of a theme almost in what we're talking about today, is the opioid epidemic and the impact of the opioid epidemic on numbers of hepatitis C infections, numbers of hepatitis C infections, primarily most of that being driven by an increase in people who are injecting drugs. A lot of folks who might have started using oral opioids or intranasal heroin or other drugs transition to injecting, putting themselves at great risk, causing other harms, but in particular, hepatitis C is being driven these days in our country by injecting drug use.
And unfortunately, in a lot of communities around the country, they didn't have comprehensive syringe services programs in place that would have helped to mitigate the effects of the expansion of the opioid epidemic in those communities. And so we're seeing, fortunately, in part because of Congress's approval of the process for accepting some jurisdictions with public health emergencies that allow them to use federal funding for syringe service programs, or at least some aspects of syringe service programs, are really kind of making a difference. And we're seeing these programs kind of pop up and grow in more and more communities, and getting support from leaders all across the political spectrum, some of whom you might not have expected to be as supportive and as knowledgeable as they now are about the important effects of medication-assisted treatment, syringe service programs, et cetera, et cetera, et cetera.
And I just want to put out there that we've seen that increase in new hepatitis C infections at least since 2010. And I've worked closely with people at the state level for at least that long and have heard their concerns over the years. And I think one thing that we all need to be thinking about is the education and the prevention that we need to put in place in order to turn that epidemic around. Because the way we're going, we're on a trajectory to have even higher rates next year when the CDC looks at their 2016 surveillance numbers. So I'm very, very concerned. And I know that, it's not always easy to find individuals who have the experience of injecting to share their stories. And it can be really challenging, especially if you're working in public health, to find people that are willing to share those perspectives. But that's sometimes some of the important voices that we want to hear are the people who are impacted themselves, who have that experience. And so I really want to thank Sara for joining us here today. And I'm grateful that Sara is going to share her story with us. Are you here on the line, Sara?
I am. This is so exciting. This is so exciting because where I come from, I didn't know that so many people actually do care. And this is extremely important for me to be involved in this. I've never been involved with something like this. Just a little bit about me. I contracted hepatitis C when I was about 21 years old. I was with this guy, and I was using his syringes, and they were dirty. And I remember thinking, kind of there's just a stigma that comes with injecting drug use. You're going to contract hepatitis C. My liver was failing. All my organs were failing. I finally get through all that, get me better. And as I'm being discharged, they're like, oh, yeah, and by the way, you have hepatitis C. And I remember my heart just dropping into my stomach. And I remember wanting to use that as an excuse to use. I mean, there's all kinds of emotions that went along with it. My dad also is a veteran who contracted hepatitis C in the military, and I just knew how it affected him. But I went to the gastroenterologist, and I don't think they educated me correctly, because I went the next 9 years thinking that I was Hep C positive. I treated myself and everybody else as if I was Hep C positive. I was a tattoo artist for 7 years, so I was really, really good with bloodborne pathogens and knowing how not to transmit. I was clean, I had a baby, thought I had hepatitis C, took precautions, was careful with nursing, went out and used. I relapsed, and for 2 years I used dirty syringes. And that's part of what I hate doing is I hate telling people that about myself. But nobody's talking about it, and it's so real. It's not that I wanted to do that; it's that I couldn't stop doing that. And to know that somebody is infected and to use their syringe because I'm infected as well, that's just not okay. Okay. So then I got clean again, and in 2014, I called the health department, and I was like, why don't we have a syringe exchange here in Knoxville? And they're like, well, you're the first person that's called. And from there, I got a fire in my heart. And since then, I volunteered with a local nonprofit called Positively Living. They work with HIV positive people. And they had these tests that I could do confirmations, because not all these people are positive. Not all these people have the virus, and they're putting themselves in situations which could ultimately lead to co-infection. And, you know, and I worked a job, and what ended up happening is I now work for Positively Living. I'm their HCV prevention coordinator. My heart is in these rural areas. If you guys look at the map here in Tennessee, all those areas are what I cover, and there's nobody covering them. The health departments are just now getting to where they're able to confirm. I'm just now being able to get into those areas, because I went to Claiborne County, and I was like, what do I do? How do I get to these people? All there are trees, you know? And I thought, okay, probation offices. So I got a hold of community corrections, and then there's other programs that I volunteered with, and I'm just, you know, building this program where I'm reaching into these areas to these people, and letting them know about the disease, educating them, and then testing them. But then the most important part, because I can't get any further, you know, is getting them to help me. You know, like, please, will you put this flyer up, which has all the information and risk factors or whatever? Like, will you put it in a laundromat? You know, will you tell your friends? Because I care, you know, and then they feel like they're helping. What I'm having trouble with is accessing them to care. I'm having trouble having gas to get to these areas. But I have a lot of people who want to help, and it's really a beautiful thing to be able to be a part of this, and to just keep working hard. I mean, I get really, really tired, but I know that if I just keep doing this, more people are going to have access to care, and they're going to get to see the other people care. Because the doctors never even informed me when I was pregnant that I didn't have a viral load. Like, there's something disconnected right there, and we need to work on that, especially. You know, just like, I went to the homeless shelter and just asking them, like, what can I do? Like, here I am. This is what's going on with me. What can I do? And they're like, go under that bridge, because they're not allowed in here. And they're so grateful that somebody cares just a little bit. And that little fire that lights up, you know, that's what we can, that's what starts to grow. And then they become, you know, sitting in my shoes, you know, then they want to be doing what I'm doing instead of putting a needle in their arm every day. That's not what they wanted to do. You know, it's really a messed up situation, and I could go on and on, but I'm really grateful to be a part of this. I just got an email yesterday for an application for a strange exchange program here in Knoxville. So, you know, we're working hard and
paying it forward. Thank you so much, yes. Sarah. That's amazing. That is such a wonderful story, and wonderful work that I think you're really looking for where the needs are there in Knoxville.
And Sarah, this is Rich. I just want to jump in real quickly and say thank you as well. I mean, some of the things I took away from just your short story was, you know, just how important it is for people to have hope, to believe that they can have a better future. And without that, people aren't motivated to change anything. And by getting involved, setting up the syringe service program, I mean, really making that stuff happen, that's amazing. And it shows the power of what individuals can do. And it shows that when we get out there and we actually do stuff, when we make change happen, we feel better about ourselves as well. And so I think it's just really, I mean, these are all been really incredibly inspirational stories. And so, Sarah, thank you so much for being here.
Absolutely.
And for the work you do each and every day.